Discussing results with patients. Understandably, many patients are very anxious about the results of their procedures, and it's important to take time to explain thoroughly and in language which they can understand. Even with experienced clinicians, sometimes the terminology can be confusing and misinterpretations occur. Always allocate enough time for the individual to ask questions and check back that they understand the implications of the findings. Neither anal pap smears nor high-resolution endoscopy are 100% sensitive or specific, so it's important to use both pieces of information to form an assessment of the patient. As a general rule, the most serious abnormality is the one which should lead your clinical judgment. For example, if you have a high-grade pap but a negative biopsy, then you have to assume that there is high-grade disease present in the individual which has been missed at high-resolution endoscopy. Likewise, a negative or low-grade pap associated with a high-grade anal intraepithelial neoplasia biopsy, it's the H gain on the biopsy which determines how you handle that patient. Having spent time explaining the nature of the results to the patient, it's important to develop an action plan. The scientific literature is still evolving in this area, and many clinicians in certain parts of the world advocate ablation of high-grade anal intraepithelial neoplasia or H gain. At present in Australia, we adopt an expectant approach. What this means is that we monitor very closely individuals with high-grade disease. This policy is based on the knowledge that high-grade disease in the vast majority of people does not progress to anal cancer. The exact figures are slightly unclear at present, but typically 1 in 500 to 1 in 1,000 cases of high-grade disease will progress to anal cancer per year. People with HIV are more likely to progress to anal cancer, but even people with HIV, the risk of developing of anal cancer with a high-grade biopsy result is between 1 in 300 and 1 in 500 cases per year. In the rare cases when progression from high-grade disease to anal cancer does occur, provided the patient is under close follow-up with high-resolution endoscopy, intervention can be just local surgery, or in more severe cases, chemoradiotherapy. In all cases where the condition is diagnosed at a very early stage, treatment is 100% successful.